Okay, so this is a video blog I think that's needed after an article that came out on in the Examiner on the 5th of September 2016. So I've seen the online version of it. I haven't seen the physical yet, but I presume they're going to run the same headline. And the first thing I need to say is that headline is completely inaccurate, and it's a pity really because it and if I treat people with persistent pain day in, day out, and I can see that if any of my patients read that article, they'd be absolutely furious. And I was furious. And people are on Facebook, they're calling us Muppets, they're calling us bellends. And you know what? I can actually see why you would react like that based on that headline. So I'm not going to take it personally at the moment, although it's still it's a little bit interesting when the old Facebook rage these days. It's just as bad as car rage. But physios think that your chronic pain is all in your mind. Now that's completely inaccurate. Okay, and this is the reality of this situation. Okay, is there's a lot of people going to pain management classes and they're coming out and they're thinking, oh my God, they think that this pain is all in my mind, I'm making it up. And from my point of view, and I'm not speaking for the other physiotherapist who was interviewed for this article, okay, from my point of view, pain is not in your mind. Pain is an output of the brain. It's a very real experience, okay? Just like you experiencing anything else in your life, okay? Just like you being happy, being sad, all these emotions that you feel, okay? Pain is one of these that can combine with feeling angry, okay? So you can be angry and have pain, but you can also be happy and have pain. So you can laugh so much that it hurts, okay? Now, pain ultimately, okay, is a warning signal to the body that something is either wrong or your body, as one big system, is perceiving that there is something wrong. Okay, so it's either an actual indicator that there is damage in your body, okay, just like you've rolled your ankle and your brain's telling you, whoa, 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 I've rolled my ankle here. Okay, you need to relax, you need to take action, you need to change something. Or for a lot of people where there may not be any structural problems, or where there'll be issues that actually physiologically they've gone past the time period where the tissue should be healed now, pain is still present. Okay, and that's what we kind of talk about persistent pain. Okay, so there's somebody on the Facebook page and they're talking about A&E and shortage cuts and imagination, which is just completely wrong. Because if you actually read the article, no one's mentioned imagination, and people go up to A&E majority of the time for acute pain. Okay, so that's pain that's just happened, and we're not talking about that today. Okay, so that's just the first thing. I'm going to try and answer all the questions here as well because it's so important. This. Okay, so as I said, pain is a warning signal. Okay, it's designed to take action. So that lady that was on Facebook on about her enlarged kidneys, that pain was very useful because you got the help that you needed, okay, as a result of this pain. Now, persistent pain lingers when people don't take action, okay, or they don't know how to take action. So they're getting all these warning signals, but they don't know how to change them. Now, I'm not saying for a second that there may not have been trauma to your body in the past, because I've worked in professional sport for 8 years and I've seen injuries happen in front of my eyes where there's trauma. So it'd be a bit silly for me to go, okay, no, it's all in your mind, and I probably wouldn't have lasted that long in professional sport. So there's one key concept that wasn't covered in this article. Now, how I look at the body, okay, is I look at stressors. I don't look at stress, okay? In theory, it is stress, but they're stressors to the system. So how I approach bodies, I look at everything and go, okay, what is stressing this system at the moment? Now, usually there's two types of stressors that I look at. Okay, there's physical stressors and there's emotional stressors. Okay, now physical stressors are just as important. These are anything that stressed your system physically. Okay, it can be trauma, it can be previous injuries. Okay, all those are stressors on your system. Okay, so that's what we kind of need to define here, and that wasn't made clear in the article at all, is any previous injury ultimately is going to have stress on your system, and your body and your nervous system has adapted around this injury, because us as human beings, we're very robust, durable people, and we need to understand that. Just because we have an injury, our bodies the majority of the time can restore, okay, our ability to live pain-free, but sometimes the neurological system interprets these issues, okay, and it gives these warning signals long after, okay, the actual tissue is healed. Okay, and even people with disc bulges and fluid coming out of discs, it's been shown that our bodies can actually clean up a lot of these fluids. The immune system can take it away, and when they rescan people, okay, that a lot of these issues have reduced. Okay, also, and I'm going to have some stats up here, there's a lot of people that if we took them in off the road that are in absolutely no pain and we scanned their low backs, their necks, whatever area of the body you want to talk about, that they will also show signs of having pathology. Okay, they'll show signs of having disc bulges, they'll show signs of having degeneration, and they're absolutely pain-free. So that's a very important lesson that we need to understand, is just because we see something on the MRI, okay, a lot of times we can't really say for definite that this is driving the pain. Okay, now what usually happens is you've got pain, you get a scan, okay, we see this result on the MRI or the X-ray, we go, okay, that's causing the pain. But the reality is, if we'd scanned the back or wherever the area of the body is a week before the pain came on, it may have shown the exact same MRI. Now, there is cases where you will have a trauma, okay, and we may have some structural damage, okay, but that is very, very rare. And even in those cases, okay, those people, okay, can go on to live pain-free lives, okay. Now, I'm not going to sit here and say everybody can, because I don't know the case. It's a case-by-case thing. But the key message here to understand is that pain and persistent pain is perceiving a threat, okay, after a period where in theory, physiologically, the tissues should be healed. Okay, so this warning signal, it comes up from the messengers in the hands, it comes up to the limbic system, okay, which is kind of the lower brain, and for the majority of the time it gives a quick fire reaction. So what happens there is it basically makes a split-second decision without you having a say in it, okay? So it's the subconscious mind. Now that's the same as, have you ever been in a situation where someone might have said something to you and you just absolutely snapped, okay? You said something without even thinking, you were like, oh my God, I can't believe I said that. Okay, what you've used there is you've used the lower part of the brain, okay? We call it the quick and dirty brain, okay, from the guys that taught us this. Okay, and that makes quick fire reactions, and that's making thousands and thousands of these a day. Okay, the problem is our brains will find a way to make things easy for us. Okay, we'll always find that the easiest way to do things that's going to cost less energy. So when these messengers start to move, okay, that sends the signal up to my brain. This part of my brain gives this quick fire response. Okay, now sometimes it's not appropriate. So somebody that's got really tight hamstrings, that's got really tight low back muscles, ultimately that's being controlled by the brain. So the message comes up to the brain, okay, I'm here. Okay, I'm going to make a split-second decision and I'm going to tighten the muscles. So that's what we're talking about in that article. So Huddersfield Giants players will come in with a tight hamstring, or they've been training all day. Okay, I step back and go, okay, why is that hamstring tight? Okay, so chances are the player's been in a lot of positions today that's put stress on his body. Okay, his body's adapted because his body needs to overcome this. His body needs to train. His body needs to get through 80 minutes of rugby. Okay, and I was quoted as saying it's 90 minutes there again, which is inaccurate. Okay, I've been working in rugby union and rugby league for 8 years. I'm pretty sure it's 80 minutes. Okay, although in the article it says 90, but back to the point, the player just needs to get through that, and he will find a way to get through that. Now that mightn't be the most efficient way to do this, but he does it, okay? And next thing, he might have put a bit more stress than he would have liked onto that hamstring muscle. So that receptors in the hamstring then give the signal up to the brain going, hey, there's a lot of stress being put on me at the moment here. So sometimes that's okay, but if that message keeps coming up, then the lower part of the brain goes, okay, I'm going to make a decision here. And what it usually does is it tightens the hamstring to keep it protected. Okay, so if we take a step back from that, it's not the hamstring's fault. Okay, the hamstring's actually done a really good job there. Okay, and for the majority of back pain cases, the lower back muscles, okay, have done a really, really good job. People are talking about their lower backs being weak. the low back is one of the strongest areas in the body, and the low back has done a great job for a lot of people, and the tone of the tissues, etc. The majority of times that we have to help people is actually to convince the lower back muscles to relax, okay? Because actually they're doing too much work for us. And if we can get the lower back muscles to relax and get the hips to do their job, get the foot to do their job, get the rest of the body to do their job, then the lower back doesn't need to do as much work. And all of a sudden then these messengers from the lower back area that are going up to the brain, okay, aren't going to be perceived as doing too much. So what happens then is the brain may go, okay, I don't need you to be as tight anymore. Okay, I can dampen down the signals. And that's usually what people are getting relief with massage and stuff, is because we're sending a different signal. We're convincing the brain. We're giving it a different stimulus to the lower back. The messages are going up to the brain and the brain's adapting it. Now, the problem is when you get off the massage bed and you go down to the car park, okay, usually the tone of the tissue is tightened up again or a few days later. Okay, so what that tells us is that we just haven't convinced the subconscious brain that we're safe yet. Okay, and pain is good, and it's all about keeping us safe. That's the priority. Okay, so what I'm saying in this article is what we started to do is look at stressors to the system. So a stressor to me is any previous injury that you've had, because that's going to have altered how you're moving now, which is potentially putting stress on other tissues that you may now come in pain with. So you may come in with back pain now, okay, with that left-sided SI pain down your leg. Whereas actually when we question you, you've broke your one of your toes on your right foot, you've had knee surgery on your right knee, okay, and you've also tore a right hamstring. So how the body usually reacts with that is it's going to put a bit more pressure on the left leg, usually subconsciously. Because if we have a choice, the brain, and this has been proven in research, the brain will tend to go towards the other leg, okay, to protect you. Just short term, okay, then we develop these habits, and then on the back of that, a lot of kind of these habits happen then where, lo and behold, a few months, years, whatever later, that left-sided back and that left-sided SI, okay, gets a little bit grumbly, because those messengers are always going up to the brain going, whoa, 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 I'm doing a lot here for you. I'm doing a lot of work here. Okay, and then what happens is the brain will ignore it for a long time, but then those tissues get sensitive because they're constantly sending messages up to the brain. Okay, I'll link it to my 2-year-old. At the start of the day, I'm minding my 2-year-old, and she's going, iPad, or whatever she's saying, okay, and she's whinging a little bit. I can deal with that, but by the end of the day, by 5:30 p.m, when the last time she says it again, you've had enough, because you've heard it all the time, so you get this quick fire reaction, and that's usually what pain is. Okay, you've heard the same nagging sound, okay, the brain's hearing this nagging sound from the messengers all day, and it gives a quick fire reaction. And that's usually when we go to bend down, okay, to pick up a piece of paper or something like that, and our backs lock up into spasm. That quick fire reaction, okay, and that Rob Morehouse, I think he called me a muppet, he said, they've never had chronic back pain. I had chronic back pain for about a year in university. Okay, and I had back pain. I had really bad back pain about 2 weeks ago. I was training down in extreme conditioning on a Friday morning. I was doing a lot of weights where I was lifting overhead. Obviously, the messengers in my lower back were being stimulated. I went into the clinic, I sat down like this, and I just bent forward a little bit, and the whole back went into spasm. Okay, I couldn't move for about a minute or two. But luckily for me, I understand what's happening here. Okay, I knew, and I could actually reason exactly why this happened based on the weights I was doing that day, because there's always a reason why we have these issues. But I was able to change my movement behavior. So what happens? I start holding my breath, I get tense, okay, I tense the muscles even more, okay, and I start altering the way I move. And that's what's happened now with a lot of people with back pain. It's not the back pain that's the problem now, it's the reactions that we do after the back pain. We start holding our breath, we tense our muscles, we start using these kind of rigid strategies, okay, and once we reinforce these as habits, then that's when it gets a little bit trickier. So that's ultimately what we need to do from my point of view, is people with persistent pain, we need to override this quick fire response that's happened, okay, this holding our breath, bracing, tightening all the muscles in the back. We're afraid to move, so we almost what's the word I'm looking for? We almost expect the pain before it happens, okay? And this is all normal, okay? This is all normal reactions. This is what happened to me 2 weeks ago, okay, but I was able to override the response of the lower brain, okay, and convince it that I was safe and relax the tone of the tissues within 48 hours, okay. And I expected my back to get back. I could not move on that chair, okay. I was getting up like an old man, okay. I couldn't get up, but in 48 hours I was expecting that to relax, because the majority of tissues will relax. Majority of injuries will settle down in 48 hours. Compare me with somebody else who's done it. Oh my God, it's my disc. Oh, I've done this, this, and this. And you know what? If I went to the hospital and I got an MRI scan, I'm sure my low back would show a disc bulge. Okay? Because it's a normal part as we get older that a lot of people have disc bulges. Okay? It's a normal part of us. Okay? So I can't assume that is my disc bulge there, okay, that's caused this massive issue. Then if I'd gone to see a surgeon and he goes, okay, you've got a disc bulge here, you can barely move, what am I going to think then? I'm going to be afraid to move even more. Okay, so it's a vicious cycle. And, you know, it's really, really affecting people's lives, how people are sitting in work. People are afraid to go to the gym because they're going to hurt themselves and even more, you know. And I see this day in, day out with people. Okay, and a lot of what we're doing is we're giving people confidence and we're showing them how to override that system. And that's what's on the end of that article there. How you can override this limbic system. Okay, one of the few ways that we're lucky enough to do it is through breathing. Okay, because breathing is subconscious, but we can influence it consciously. And that's very, very powerful. So if we can get our breathing rate, okay, down, we can influence the breathing rate, which is going to influence the heart rate, which is going to influence the ability of the diaphragm to move. Okay, which is going to leave us feeling less rigid. So that's the tip on the article about breathing. Okay, even though it doesn't actually just thrown in there at the end in this. Okay, so that tip, okay, is something that I'm going to touch on a little bit more. And what I'm going to do is to go into this a little bit further for anyone who's interested. Is I'm going to put a webinar on. Okay, next Tuesday the 13th at 7:15 p.m. So you can sign up to the webinar now, and I'm going to do a presentation. I'm going to show you some videos. Okay, and explain how this stuff works more. And more importantly is I'm going to give you some tools how to override this stuff. Now, am I saying that you're going to be completely pain free after that one webinar? No, but what I'm saying is you're going to take the first step in taking action, in changing these reaction through the limbic system, okay, or through the lower brain, to help change the tone of these tissues, okay, which is then going to dampen down the warning signals. Okay, and that may change your pain levels. Okay, from there then we're going to show you exactly how to progress this and where to go from there, because ultimately everybody's different and everybody needs a different rehab plan, and there's no one magic exercise with this. It's very specific to what you need, because you live your life completely different to somebody else. So that's what I mean. There's no magic exercise here. You can't just come in and go, okay, do this exercise, you're going to be absolutely fine, because how you live your life is completely different to how someone else lives their life. Okay, so I hope that's kind of cleared up a little bit about what pain is and what pain isn't. And to summarize, pain is not in the mind, absolutely not. It's an output of the brain, it's a real experience, but pain is basically an output that's a result of an interpretation from the subconscious mind based on what's actually happened, now real damage or perceived damage from the tissues in the body. Okay, and then the subconscious mind has the decision, and it's people that have pain now where physiologically the tissue should have healed. That's the people we're talking about in this article. Okay, there's somebody here that said, you know, we had enlarged kidneys. Yeah, the pain was good in that case because it actually helped you get to that point to find that you had enlarged kidneys. So we're not talking about that. What we're talking about is people that have pain, that it persists, okay, despite a time period where things will relax. And that's the same with nerves, okay? If you've got a trapped nerve, okay, which I'll leave you in a little secret, our nerves get trapped every single day, okay, numerous times during the day. Our nerves get squashed, they get twisted, they get turned. That's not the problem. It's when our nerves get sensitive, okay, and they're getting squashed maybe on a repeated basis, that the messengers then from those nerves go up to the brain and then they get sensitized, okay? So they're constantly badgering the brain. The brain's doing a great job. Shut up, shut up, shut up. I'm in work here. I need to do this, okay? But at a certain time, you'll get that quick fire reaction from the nerve, okay? And that's usually then when you're going to get symptoms, okay? So a lot of these tissues are sensitized, Okay, and the good news is they can desensitize now. So for some people it takes a while, but for some people it can happen quite quickly. Okay, so that's very, very important to understand. So Nikki there was had an MRI scan where the consultant says she needs an operation to free the nerve being crushed in her back. Well, again, I don't want to comment on your MRI scan, and there is some people that need operations, okay? But what I would say is that we could be looking at 5-10% of people, because a lot of people, okay, will have these MRI scans, and they will be very, very different, okay? They'll be shown a different clinical presentation, because I'll get a player scanned and I will see I will expect to see disc bulges, okay? I will expect to see all these presentations, and the best radiologists in the world, okay, and the best surgeons in the world take this into consideration. They don't just put you on the bed or have a look at you for 10 minutes, do these weird tests, okay, that, yeah, it might stress the structures, but actually, these movements might be the first time you've ever done these movements, because this mightn't be how you're living your life, okay, so you could be stressing that nerve in a completely different way to the test that the consultant done. So we need to take the clinical presentation into consideration with an MRI scan. Okay, how are you presenting? How are you moving? How are you moving on a day-to-day basis? What's that doing to the nerve? Okay, rather than just doing a few tests and then making a presumption. Okay, so we just need to be careful. Now, as I said, it may very well be that you do need an operation. I'm not saying that you don't, but a lot of people have these disc bulges and they're living pain-free. Okay, and a lot of people will have them. They'll have a bit of pain, and then the pain will resolve, okay, over time. So we just need to be careful at generalizing. Just because an MRI scan says something, that's a small piece of the picture, okay? And unfortunately, a lot of people they kind of get fearful. Oh my God, I've got this thing in my back, which people don't even understand, really what it actually is. Okay, people are, these analogies of a donut and the jams coming out of them and stuff, and it's not really like that. Okay, and all these words get thrown around, and they are fearful words because people don't understand what these things mean, and then they stop moving, they start bracing. Okay, they're fearful for their movement, they alter how they breathe, and then the vicious cycle happens again. Okay, so Lorraine, who was a nurse, and she says, bollocks, might be for some people, but having been a nurse from the 80s with the use of hoists, the back pain I get is most definitely not in my mind. So that back pain, Lorraine, I would suggest, is that just that those tissues are sensitive. Okay, that the messengers from those low back muscles, okay, the ligaments, the nerves, they have been called on for a long time. Okay, and they're almost just fed up. They've had enough, because your low back muscles would have done a great job for you back then. They would have helped you a lot. Now, what may happen is that those tissues may be sensitive now, okay, and what we would need to do in that case is actually desensitize them to take away the pain signals, because that pain signal is no longer useful for you if you've had this for a period of time, where in theory the tissue should be healed. And most muscles will heal within 12 weeks. Okay, if you have disc issues, if you've got nerves that have been sensitized, again, a lot of these will desensitize, but we just need to know how. But what's not going to help them desensitize is being fearful of our problems, being angry, and holding our breath, and all these different movement strategies that happen. So as I said, it's a vicious cycle that happens here. Someone talked about trigger points. Well, I think it was Chris. You have to ask yourself, why is a trigger point happened? And the brain, with that quickfire reaction, sets the tone of the tissue, which ultimately develops the trigger point. Okay, so trigger points, it's not as easy as that. Now, some people, once we do some hands-on work, they can get very, very good results. Okay, but for people with persistent pain, a lot of these people don't even like to be touched. Okay, because they're so sensitive now that if we try to put our hands in them, almost the pain starts. Okay, so it's not as simple as that. I wish it was. Okay, Michael Hargrave, that's why it hurts to walk, get out of bed, prevents me from lifting a lot of things. Okay, so again, Michael, he calls me feckin' Egypt. I don't know, is that because I'm Irish or not? So again, Michael, the headline was inaccurate. We're not saying for a second that it was because of it's in your mind, not at all. But what's happening here now is it hurts when you walk for a particular reason. Now, I don't know the history. You may have had trauma, okay, that potentially should have healed now, Okay, I don't know. So this is the thing. We can't generalize this stuff because it's very, very specific, and that's what the article didn't get across. Robert Morehouse, yeah, calling you a muppet. Um, and yeah, I actually have had chronic back pain for about a year, Robert. And as I said, I done everything wrong. That I should have done. And again, I experience back pain now and again. But my belief system has changed now because I understand this stuff because I've actually gone out there and studied it. And I've spent a lot of time actually learning what pain is and what pain isn't. But the problem is that people are thinking that pain is a reflection of tissue damage, because sometimes you can have a lot of pain and sometimes you can have a small bit of pain, but nothing's really changed in the amount of damage, okay, to the tissue, okay. So the amplifier effect, which is the pain's worse at certain times of the day, and that's where sleep's important, because sleep will ultimately affect your level of pain. Okay, so if we don't have a lot of sleep, which a lot of people with persistent pain don't sleep very well, okay, that can be another big reason why pain is so intense. Okay, yeah. So Rachel attended 5 days with early back pain because of enlarged kidney. So again, your pain was good that time. You went to the doctor. They found you had large kidneys and they dealt with that. Okay, you took action. The pain done its job. Okay, this Paul Hay about A&E, about, again, no one said anything about imagination. You need to look and understand the difference between acute and chronic pain, because I just can't even answer that one really. I don't know, maybe trying to be funny. Okay, Fiona Ware deliberately being controversial to try to get into the local paper. There's no controversy about this in terms of, in my mind, because this is all evidence based. This is all in the literature. It's just healthcare professionals are being sloppy with what we're telling people, and what you're hearing from us as healthcare professionals is ultimately letting you down because you're changing your behaviour on the back of what you've been told. People are fearful, they're afraid to move, they're sitting in certain ways now, afraid to relax. Okay, and all this is happening because of what we as healthcare professionals are saying to people. Okay, and there's no controversy about this. The leading back pain researchers in the world, this is who I'm learning this from. Okay, so, you know, as I said, it's not just a case of being controversial here. I see people every single day whose lives have been affected for 15, 20 plus years. They can't lift their grandkids. They can't go for walks with their partners. Okay, they can't wake up and get out of bed without feeling pain. Okay, there's a lot of emotions involved here. Okay, and I see these people every single day, and that's why we're trying to help these people now here. So I'm not just doing this to be controversial. Okay, I've got nothing to gain from that. What we're trying to do here is make people aware that just because you have persistent pain, there is ways to override it. And that's what's down in the bottom of that article, which has gone unnoticed, and it's not really put into context, it's just thrown down there, is how to override this. The first part that we can do is change our breathing pattern. Okay? Lisa Butler, this annoys me. My husband cries in agony with his back and legs, so trust me, it's not his head. And you know what, Lisa, I felt sorry for you there, because you got emotional reaction which made you write that on Facebook. And to be honest, I can see why you are emotional if you read that headline. Again, it's not true, and I completely agree with you. The pain isn't in your husband's head. So what's going on with him, I don't know, because we don't know his stresses to the system. We don't know what previous injuries he's had. We don't know what stresses he's had in his life. Okay, which is then ultimately sensitizing the system. So that's what we need to find out there. And again, Lisa, I'd advise you get him to come on to this webinar, and I'll show you some ways that may give you clues as to how you can change that perception. Carly, can this do one of my big bazookas, causing my spine to curve? It's all in my mind. Poof. Okay, so again, Carly, a bit of an odd one, but again, play a devil's advocate. There's a lot of people out there with big bazookas, okay, that don't have pain. Okay, so why is it that one person does but one person doesn't? Okay, so it's not just in clear cut. Now this is a good one from Scott Brandt. My faith in physiotherapy as effective treatment has rapidly disappeared over the last 12 months. I see this all the time. Okay, this doesn't surprise me, Scott. I've seen 3 separate physios for persistent back pain. All said it was a muscular issue until I took it upon myself to request an MRI, which revealed 2 slip discs. Okay, slip discs isn't good terminology. It's frightening. So when you think of a slip disc, oh my God, if I do one wrong move, it's going to slip out. The disc will not slip out one bit, I promise you. Okay, the terminology that we're using is absolutely horrendous. And the problem is, these slip discs, it's making people fearful. Okay, so the chances are now, what do you see in your mind? When you think of a slip disc, Scott, what image are you thinking in your mind? Okay, so what we're given then is this perception that, okay, my back is almost made of glass kind of thing. Okay, and I really do empathize with you here, because this is what I see on a daily basis, and it is so frustrating. Okay, so I'm about £500 worse off for persisting with physio. Okay, well, in a way, in terms of putting value on it, okay, I'm not going to comment on that. The musculoskeletal fracture after being diagnosed with a slip disc osteotomy, my pain was only as bad as my brain was making it. And to be honest, Scott, that's true. But it's only half the scenario here. When I tell my brain to, I'll tell you what then, I'll tell my brain to tone it down, shall I? What these people with this theory fail to realise is we don't care why our brains are making the pain this bad, we just want it to go away. Exactly, Scott. And how you make this pain override this pain is with the breathing tip at the end of the article. Okay? And that's what I'm going to cover on the webinar, is how to override this limbic system. Because our brains are plastic, they can change, okay? Neuroplasticity, if you just want to Google that in, how our brains are hardwired at the moment, they are adaptable, okay? They can change. And that's exactly why we've put that tip down there, although it's not very clear. Eventually I saw a neurosurgeon who recommended steroid injections and then surgery. The neurosurgeon said the physio could also have made the problem worse. Yeah, but you know what? Surgery can make something worse, okay? So again, I can't comment on that case because I don't know what the physio has done with you. But what I would say is, if you want to know how to override this interpretation, what we need to do is we need to change the reactions that are happening in the body. We need to decrease the perceived threat. We need to change the breathing pattern back to where it was. We need to restore your ability to do that. We need to restore the ability of muscles to load in correct timings with other muscles. Okay, we need to change this behavior that's happened now where a lot of people are going to brace. Okay, there's a lot of work to be done here. Okay, but you know what? More importantly, we need to do this specific to you, because there's no point me lying you on your back going, okay, I want you to not think of the pain, I want you to pull your belly button in, and I want you to get your trans abs, and then I want you to do some glute exercises, because that's not meaningful to the brain. That's not how the brain works. If the brain doesn't see value in something, it's not going to make it stick subconsciously, okay? So it has to be a very meaningful movement. And again, I'm sorry you feel that way about physio, and part of the reason I'm trying to get this information out there is to help people see the value, because I've got some patients who want to come in and they want me to do some massage on them. They want to spend basically 45 an hour actually just getting hands-on treatment. And I know for a lot of these cases, that's not making them better. Okay, that's just making them rely on me to do passive interventions, which ultimately, by the time they get out of the car park, yeah, we might have tricked the brain and we got a bit of a relaxation, but it will not be long lasting. Okay, and how we override this and how we actually change the pain levels is through influencing ultimately the limbic system. Okay, and that's where the breathing can be very, very powerful in addition to some other stuff. So it's not just simple as doing a bit of breathing. There's a lot of work to be done with cases like this. And I'm not here to tell you there's a magic exercise or a magic pill. Okay, so again, I apologize for the physio profession treating you this way. And in actual fact, that is a true statement, that the pain is only as bad as the brain is making it. So the brain is interpreting this to be a problem. So it's intensifying the pain for Scott to take action. Scott took action, okay, and now hopefully, Scott, you're getting the resolution that you're after. So that clinician was actually correct in what he said. But what he probably didn't do, or she, was give you the tools in order to do that. Okay, so you just need to reconsider that actually what the information they are saying is true, but they just probably didn't show you how to go about it. Okay, and then there's a few others. Vaccine damage. Again, vaccine damage, what's that? That's a threat to the system. Okay, that's stressed your system, okay, which is causing pain. It's telling you something is either wrong or your system thinks something is wrong within your system. Okay, so pain is an indication of either real damage or perceived damage, but for a lot of people it's perceived. Okay, so we just need to be careful with that. Okay, so just to summarize, I've gone on for a little bit longer. Pain, okay, persistent pain is a warning signal, okay, of either letting you know that there's damage to some tissues or there's perceived damage. Now keep in mind that a lot of tissues will resolve within 12 weeks, okay? Sometimes takes a little bit longer, so that's the good news. What we need to do is we need to override that limbic system, okay? We need to override these quick fire reactions that's altering our breathing rate, altering our behavior, altering our thoughts, okay? If we can do that, and one of the best ways is to use the breathing tip. Okay, and what I'll do is on that webinar is I'll go into a lot more detail on that for you, and I'll help you to actually override these systems. Okay, so 7:15 p.m. next Tuesday. I hope you join me. If you know anyone that has persistent pain, then please, if they're interested and they want to change and they have to be motivated to change, then get them on that webinar, and I'll go into this in a lot more detail with a lot more images to make it a little bit more easy to understand. So once again, I apologize for that headline. It really is a bad headline. It's a pity, really, because actually there is some decent information in that article, although the context of the information just could be a little bit better. Okay, so if anyone's any questions, obviously feel free to get in contact, but the best thing to do is just join that webinar next Tuesday night, 7:15, and I'll show you some videos, I'll show you some stuff, and I'll actually show you how to override this system.